We're here with Dr. Brian Bai talking about Clubfoot. Dr. Bai, for those with a child who's been newly diagnosed, what can they expect this new journey to look like?
Well, with a family having a child diagnosed with Clubfoot, it can come as quite a shock. Some families have had the diagnosis due to a prenatal ultrasound, but many find out the day that their child is born. The first thing I would like to tell them is that their child has an excellent chance of having a normal foot and that they can participate in any activity later in life without any deficit.
What is your approach in treating Clubfoot in babies?
The standard of care is a series of casts that manipulate the foot while the child is still newborn. Along with that, my philosophy is a minimally invasive, where surgery is only performed when necessary. Most of the treatment, hopefully, is actually without any surgery at all.
So what are some of the treatment options?
For a newborn that's been diagnosed with Clubfoot, the first thing that we do is actually start by manipulating the foot. That's something that's performed in the office. After this manipulation, the newborn foot or feet are held in plaster casts. These casts are then changed approximately every week. At the end of the casting, there typically is a small surgical procedure that's needed. And then we transition the baby into a specialized brace to hold their feet in a good position.
If surgery is needed, what steps do you take to ensure the best possible outcomes?
For the surgery, we utilize anesthesia to help keep the infant or child comfortable. After the surgery, to ensure the best result, we once again use a cast and then eventually a brace. And it's been proven that using these casts and brace give the child the best chance of having a quote-unquote normal foot as they continue to grow up.
For those watching this who may have a child that's been newly diagnosed with Clubfoot, they may be looking at this as this is maybe a long journey ahead. What words of encouragement do you have for those?
It's definitely a long journey, particularly for the parents. The treatment of the Clubfoot is pretty labor intensive. As we discussed before, there's several weeks of casts. That means several weeks of clinic visits. There potentially is a surgery, though minor, is still a surgery. And then typically there's years of wearing a special type of brace. And so I really encourage the family to keep up with it, and that the child at the end of this will have a very functional foot and will be no different than their classmates or friends.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.